Hi everyone, and welcome back to our Q&A series. Today we've been talking to Dr. Kylie, who is the lead chiropractor and founder of Organic Family Chiropractic, who we work very closely with at Beloved Bumps. And we've been asking her all about chiropractic care, how it can help, and what the difference is between things like chiros and osteos, for example. So have a listen, and hopefully you'll get some really interesting information. Okay, so today we have Dr. Kylie from Organic Family Chiropractic, who are very close partners of ours and who do a lot of our talks in our prenatal classes and see the majority of our women from our prenatal classes as well. So we're going to talk a little bit about chiropractic and how it can help pregnant mummies and also babies. So Dr. Kylie, can you tell us who you are and what you do?
So, hello, I am Dr. Kylie Foster. I'm originally from the UK. I've been in Singapore for 7 years now, so I've been here quite a while. And about 3 years ago, I set up my own dream practice in the heart of the East Coast along Chat Road, in a beautiful old shop house, really kind of like homey vibe is basically what I wanted it to be. And it's pretty much a sanctuary for families is the way that I feel about that place. Really, like I've ever since probably even actually before I graduated, I've always been fascinated with young families, babies. Like I'm the eldest grandchild, so I was always forced to look after the younger kids, and just it's always been in my nature to do that. So it kind of followed through university, and then after I graduated, decided that I really wanted to specialize in pregnancy and pediatric care. So I graduated, and pretty much the first course that I did a few months later was prenatal and pediatric care. Currently enrolled in a 2-year diploma program in Australia for pediatrics as well. So just to really dig deeper into the research behind what we do and the safety of it, the efficacy of it, and how we can actually really help a lot of kids with so many different things. From like last weekend, we were talking more about autism and ADHD and having like all these different protocols to really help these children just through the power of what we do with an adjustment, which is freaking awesome, to be quite honest with you. And then nutritional and lifestyle support as well, which is great. The bulk of what we do, yeah, like you said, we look after a lot of the prenatal clients that come through Beloved Bumps, which is honestly a lot of fun. Like I've just had my first baby, so I've got a 3-month-old baby, and going through that journey and coming out the other side of it, like I have a whole new level of appreciation to the side of to the job, if that makes sense. And yeah, like a lot of what we do is support, educate, empower. Like we really want women to feel like they have choices in their pregnancy and that they get to choose things. They don't just have to kind of like fall in line and follow what people are always saying at them. It's important that people get informed choice with when you start a family, like you're now responsible for a human being, right? So you've got to start making choices for them until they're old enough too. So yeah.
Cool. And I know that a lot of our mums have asked whether they should go and see a chiropractor or a physio or an osteopath, but what is the difference between a chiropractor and an osteopath?
So the best way I explain this is chiropractors are like electricians, mainly because they work with kind of like the wiring inside the body, like the signals, the impulses. A lot of what we do is a lot of the actual treatment protocol is finding out where the problem is first. So where there's a short circuit in the body, and as soon as you find that, it's like a light switch and everything goes back on. So we're the electricians. The osteos work more with blood supply. So a lot of what they do takes a little bit longer of time to do a treatment, and they'll do a lot of like pumping mechanisms. So what we call mobilization, where they'll do a lot of kind of actions that really try and get the blood flow going around a certain area of the body that may be blocked off from the flow. And then the physios are kind of like the scaffolders. So they really work with the muscular system to kind of help the body hold it upright. I've seen an osteopath before, I've seen a physio before, I've seen multiple different types of chiropractors. I utilize actually all of them for different things. So if, for example, being pregnant, I was wanting to make sure that my body's electrical system was working really well, so it could tell my muscles, my joints, my organs, my glands, everything how to work really well during the pregnancy. But at the same time, I needed to work on things like my pelvic floor. So I saw a physio that was specialized in helping with women who were pregnant and then postpartum as well. I actually also saw a cranio osteopathy, someone who does cranial osteopathy, which is kind of like not quite osteopathy, but it's a similar branch where it kind of goes off into a different area. And that was actually for more of emotional support. So you don't always just have to think, oh, I'm just going to do that one thing for my one problem. There's lots of different things that work really, really well together. And if you're looking after the electrician, the plumber, and the scaffolder, then you've taken things to the next level. But usually osteos and chiros work independently, and then they'll work with a physio is the most common kind of relationship that we would have.
Hmm. And how can chiropractic help pregnant mummies?
So our main goal with pregnancy is it's almost like setting yourself up for the marathon at the final sprint. So you have to put in all the work through the pregnancy with movement, diet, your mindset, like a lot of work if you're not already, you should be looking at doing that throughout your whole pregnancy anyway, if not before. And then chiropractic really comes into it to try and help make sure that the body's ready. So we work in more of a physical capacity and a little bit of an emotional capacity as well. So those nerve signals that I was talking about, those electrical signals, they need to make sure that the pelvis is in alignment and moving and operating well enough for where the growing baby is. But there's also a lot of tissues and structures around where the baby's growing that need to be nice and relaxed, but also ready to be strong, ready to help with you at the end when you go into labor and you need to be moving into different positions, as well as being able to have strong, regular contractions that really build up like a crescendo until you end up pushing. And then you need to have a really good recovery as well. So a lot of what we're doing is setting mum up for birth, but also enabling a baby to move into an optimal position because mum's body works really well in her pelvis. It can move and shift. And because a baby's head is the heaviest part, it's going to naturally want to follow gravity and be pulled down. But when that doesn't happen, it's usually because there's a physical or an emotional component going on with mum, and it's not allowing the baby to shift down. And then there's only a couple of times, I've seen many women who have had positional issues with their babies, and I've had 2 women who have not shifted, their baby has not shifted down. One of them had a short umbilical cord, which was detected after the birth because you don't know it during pregnancy. And the other one, we still have no idea how that happened. So, and I probably helped hundreds of women now give birth over the last few years. So yeah, so it's a really unique little specialty, and it's really rewarding, like seeing these women have these fantastic births. Like my birth, I've obviously got adjusted all the way through my pregnancy. I've been adjusted since I was 15, 16 years old. So pretty much half my life. I'm 32 now. So yeah, half my life. And my labor was a 9-hour active labor, first time mum. So and I didn't tear or anything like that, and we did really well. And I actually, ironically, had my baby shifted into a breech position, and we had to implement what we would call breech protocol in our office, which is a intense series of getting adjusted and following really specific exercises to try and create a lot of space to get the baby to shift. Luckily, she did that with a little help with some emotional support too, because that's a big factor with stress around where the baby is and hormones. And we managed to get her shifted into a head down position so that we could go ahead with a natural vaginal delivery.
And you see a lot of our mums who have got breech babies, and we have huge success rates of those babies turning just with that sort of chiropractic care. So you mentioned a little bit about how it kind of creates space, but is there sort of like specific stuff that you do which helps with that? And is there anything that mums with breech babies can do to help to turn their babies on their own at home as well?
Yeah, so we are specializing in what's called a Webster technique. Webster technique is it's a specialized chiropractic technique that requires you to adjust a woman in a very specific order. So you have a protocol that you have to follow during the treatment in order to check where there's going to be neurological issues around the pelvis and up through the spine and into the cranium, and around where the baby's growing with the tissues. So there's a very specific order that you have to do. So you have to become Webster certified in order to be kind of really on I would say the top level of your game to really try and help these women. As chiropractors, when we're in school, we do learn how to look after pregnant women, but it's a very basic level. So any chiropractor that's done additional training in prenatal care and has been Webster certified, where you have to kind of fly off to the US to go and get it, you really know you're in really good hands with them because they've done additional training, and the protocol does work really, really well. Alongside that, like obviously right now, if there's any breech women that are listening into this, and obviously we're not open, like chiropractic's not considered essential in Singapore right now. And I've got a couple of women who have been emailing us in. The biggest things that you want to do is basically force your nervous system to relax. So anything that helps your nervous system relax is you want to get it moving so it can send better signals through the pathways from the brain and the body and back again. But you also want to calm it down through your stress response. So if you're stressed, if you're anxious, if you're really kind of freaking out about what's going on, you need to find ways to relax. When I was pregnant, the best way for me to relax was Epsom salt baths at least 3 times a week. At one point, I was doing them every single day, candles, lights off, listening to hypnobirthing tracks, really just trying to unwind. I also was a huge fan of just reading. Like reading was my complete escape. I listened to audiobooks as well. That was another great escape. So you really have to find something that you can do on a daily basis, if not multiple times a day, if you're really struggling, that helps you calm down. With the movement aspect, go to a website called Spinning Babies. Spinning Babies is fantastic, and we actually use some of their techniques to help us with our breech protocol with the specific exercises that we recommend. There's 3 specific ones that I highly recommend that you and your husband, you get your hubby involved or your birth partner involved with these. The inversions, sideline release, and the rebozo technique. If you don't have a rebozo scarf, it doesn't really matter. You can just get a sheet or a towel, or just a really big, if you've got a really big pashmina or something like that, you want to put it all the way over your belly. That's how much kind of width you need on the material. And that'll be good enough for you to use to do the rebozo part as well. And then walking, just getting those hips moving. And the other one was yoga ball. So, or Pilates ball, whatever you want to call it. Bouncing on that Pilates ball, I was bouncing like a crazy woman probably in the last couple of weeks. And I think it made a huge difference when we were in labour, to be honest. And I still bounce on the Pilates ball now because my baby settles within like 5 minutes to go to sleep with me bouncing on that, cradled, and then she's down. So it's a really good investment. Highly recommend it.
And okay, let's talk a little bit about babies and how can chiropractic help babies?
So similar to the way that like we work with all the nerves in an adult, we work with them in a baby, but the actual type of treatment that they would get would be very different. So we don't crack babies. That would be not very good. So we don't do that. A lot of chiropractors like do a lot of cracking. We do some cracking in the office with the adults. But sometimes we don't even do that with some people because they don't like it, or we actually find that their bodies are already at a really, really high stress point and it's too much impulse to put into them. So we have to kind of go in with a much softer technique. So with the babies, we do what's called a touch and hold technique, which is a lot of the time just using the pressure of our fingers, which would be the same pressure that you would put on your eye that would kind of make you feel comfortable. Or another way to describe it is, you know, when you test like the firmness in a tomato to check that it's ripe, it's that much pressure. So a lot of that's done using our hands, or sometimes we'll use a little instrument that makes like a clicking noise. That's called an activator, and it just puts a load of stimulation into the body. Again, we have a protocol for like where to find out where there's an issue in the spine. There's no point just kind of cracking and popping an adult or a child or doing any kind of treatment if you don't really know where the exact problem is. That's what chiropractic's all about. It's about having a really specific point along the spine that's not working well enough. So then the signals from that area of the spine to the brain are not working optimally. So then the brain doesn't really know how to tell that area of the body how to work. So in that area, if they've got nerves that go to organs, glands, so if we're talking about, say, the lower part of the body in a baby, if they're going to have issues in their lower back or their hips, they might have issues with pooping. They might have a sleeping position where they might always have their pelvis shifted over to one side, and then their head might always go over to one side as well as a compensation. Then we'll get some flattening happening in the back of the head because they're not moving their neck properly. They're not doing it from side to side. So then we get this flattening that comes on, that parents kind of notice these bald patches on one side instead of it being that even distribution. We'll also see a lot of issues with latching as well, especially in the early stages. If a baby isn't latching to start with, a lot of it reason can be because they've got issues with the joints in the jaw here that actually are fed by the nerves that come from the back of the neck or the base of the skull. So that can be a really big issue. Other issues are excessive crying. Like that's a really big one that we see. A lot of that is because of this area up at the top. There's an area in your lower part of your brain called your brainstem that is responsible for what's called your stress response. So if as a baby we have a stress response and we can be stuck in this high stress response, we very rarely go into what's called rest and digest. we do our best rest and digest when we sleep at night or when we nap during the day. So a newborn baby should be doing lots of that. And if we're not doing lots of that and we're just having like 15, 20-minute naps and we're not a very happy baby, and then at night we're waking up every 2 to 3 hours and it's just really tough to get them back to sleep and they're just wailing, often what's happened is they're stuck in that stress response. And often a lot of these issues in babies are because there is some kind of birth trauma that's happened to the baby as they've come through it, as they come through the pelvis. So at the end of the birth, the baby has to do a bit of a twist. So if mum's pelvis isn't kind of working really well and the muscles and the ligaments aren't relaxing very well because the hormones aren't allowing that to happen because we're not coordinating well, because our nerve system's not in good control, then the baby will get stuck and it will stall the labor. So we might get to say 5 to 7 cm, for example, and we might completely stall. And, we end up taking an epidural or something like that, having a load of rest, and mum really needs time to relax her body. So then things can change and then the baby can start to shift through. Then they've got to make that final turn. So then they might get stuck again. So there can be a lot of things that kind of happen in labor that can really set these babies up to have quite a lot of damage into that upper part of the neck that really sets off that stress response and then causes other issues around, like I said, with the latching as well.
And are there certain types of birth, like a C-section or vaginal birth, that can lead to a baby being more stressed than others, or is it sort of every type of birth can have that same impact?
So research shows us that 80% of babies born vaginally will have an issue with the function of their neck. But what can happen is some babies can sort themselves out. So we always say, like, whenever we have a mum go through care with us, we always give their newborn up to 8 weeks for them to come in to have a complimentary check to make sure that they're doing okay. And really the purpose of that is to make sure that they've not got any issues. So if they have, then we can detect that really easily. We can get rid of any latch issues, constipation issues, crying issues really, really quick. So, but a certain amount of those children will just be fine. They won't have any issues and they'll actually be okay, and we don't really need to do anything. We can give them a check over, like, yeah, okay, there's a little bit going on here, but if you're worried about anything when they turn 6 months, bring them back in, or before if you're worried. So we know from the research that these children deserve to be checked to make sure there isn't an issue, and that's just the natural vaginal children. Definitely factors like increased drug use during labor, the length of the labor. So if it starts going over 12, 13 hours, then we start to get worried about, has this baby been subject to a bit of birth trauma? And then also, what's it like afterwards with mum? Like, is mum stressed? Is she emotional? Is she really struggling as well? Because then that does have a knock-on effect to the baby, and they will just cry more, and then they get stuck in that stress response, and then that sets off a little bit of a physical response afterwards as well. With the C-section babies, forceps babies, ventouse babies, so suction, like anything that requires assistance to get the baby out, we would always recommend that they are checked to make sure that they are okay. Just because we do know that, unfortunately, if you go through either an elective or an emergency C-section, the standard procedure is to get the baby's head and pull, and it can cause quite a lot of damage to the tissues in that area and the function of the spine there. And because of that stress response, it's really important that a newborn is going into a significant amount of rest and digest for their healing at night, because I say healing, but their growth and development. When babies are sleeping, that's what they're doing, because they're learning when they're awake all the time. So their body has to process it. And then the digest is they're processing all the food that they've taken in. So breast milk is best, but if they're taking on formula, whatever it is, the gut is going to have to start working. And when they wake up, then you give them a feed and they should do another poop. So they should be pooping really, really regularly as well. So you should feel like you're literally changing a gazillion pooey nappies a day, and there should be lots of explosions, and it should be wonderful. So if it's not, then yeah, that's usually a concern. That's one of the signs, actually, that maybe the nerve system isn't working as well as it should be in the baby.
Mm. And can chiropractic help with things like reflux and colic? Because we have a lot of mums who have babies with reflux and colic. It seems that it's kind of on trend. So can that help with that?
So it depends. So there's actually 3 different types of reflux. So it's normal for a baby to spit up a little bit. So just like, you know, when you have a big meal and you have indigestion and you kind of feel that rise in the back of your throat, and we're controlled enough that we don't like spew it out and it doesn't dribble down our mouth. So that's actually quite normal. And that can happen after every feed. That's completely normal. But when we start to get a lot of milk coming up, so if we start to get like almost more than about 20 to 30% of the volume of milk starts to come and go down the face, or if they're projectile, that is considered more of a true reflux. So if it's one of those two, then the second one, so the one which dribbling down the face, often that's related to often it's related to issues in that upper part of that neck where that rest and digest does not happen. The stress response is high. So therefore, they're almost ejecting the food back out again, and they're kind of rejecting it. The tone of the stomach is not right, and that can often be a neurological thing. The third one, where it's a projectile vomit, that can be a little bit more complicated, because that could be something where actually it's called GERD, which is all to do with the acid in the stomach, and it can be a lot more complex, and sometimes you do need medical intervention for that to be addressed. The one thing that I have been recommending to women who've been messaging me about with that their children have been having a lot of reflux, they're worried that they've got this GERD or GORD or whatever you want to call it, gastroesophageal reflux disorder. A lot of the times it's overdiagnosed, and probiotics is actually one of the best things that you can give your child as a first drawn measure, and take out any dairy that you have in your diet. So if you're breastfeeding your baby, you need to get your baby away from all dairy, and you need to do that for a minimum of 3 weeks. It takes that long for the body to clear it out. And then if your baby is having formula, then you may well need to go back to your pediatrician and get given a very special type of formula that it's very expensive, but you have to get it on prescription. And as far as I'm aware, in Singapore, you have to go to the doctor to get that. You can't just get it over the counter, or you can try them on a goat milk formula first, which the only brand that I recommend is the Holle, Holle, because the carry home one actually has a bit of cow's milk in it, in the brand that is put into the one in Singapore. In other countries, carry home is a pure goat's milk. I don't know why it's like that, but that's just the way it is. So Holle is the only one. The goat's milk formula from them is the only goat one I recommend. Other than that, so what was the other one? Colic. Colic is essentially excessive crying. So we see a lot of colicky babies, and actually from what I've been reading up on this, because I was a little bit concerned with our little one, whether she was starting to get a bit colicky, because we had 3 days of the same time of night. She started to get a little bit grumpy, and I was like, oh, is it not? And then I kind of went back to the whole, oh, maybe I should just adjust her, because mum brain didn't kind of click in the fact that I'm actually a chiropractor and I could help her. So I actually started just getting her adjusted, and that made a huge difference, and we didn't have any issues. But true colic is having 3 weeks of every single night for at least 3 hours of crying that is non-stop. Like, they are completely inconsolable. So if you've not suffered through 3 weeks, then you're technically not, by diagnosis, you don't have colic. You may just have a baby that's shifting into a different developmental leap. They may need something else from you. You need to switch up their routine. We went from carrying her around and rocking her like this to bouncing on the Pilates ball in a different action. I've also used 3 different carriers, because she went through different phases with that. So you kind of got to get a little bit experimental and just sort of see what works for them, and be prepared that it's not going to stay the same. Babies want different things all the time. They might want to be sleeping held upright and on your chest for a while, and then they might decide they don't want to do that anymore. So find something else, and don't freak out. Like, it's really, really normal for them to change, and it's good for them as well. Like, if they can start to get used to being in a variety of different places to sleep, different people, like mum and dad, rather than just mum all the time, slings, carriers, lying in like a co-sleeper, lying on a nest, like, you know, all different things are really, really good for them. So just let them guide you, and don't freak out, because that freaks them out.
Just general great advice, motherhood in general, really.
Yeah, like I say, it's been a whole new opening up everything to me now as well, from a different perspective.
Yeah, awesome. Well, that's all our questions for today. Thanks so much for answering the questions that we had. And if anyone needs any chiropractic assistance, hopefully you'll be opening up again after circuit breaker.
Fingers crossed soon.
On the 2nd of June. And then you guys can go and find Kylie at Organic Family Chiropractic in Juchiat.
Thanks a lot, Tash. Thanks for
No
having
worries.
me.
Speak to you soon.
Bye.